If you have been diagnosed with diabetes, it is very important to control your blood sugar. It is easy to be more diligent about your diet, but you can never know when that diabetes moment will occur. Here are a few things you can do to prepare for this time of the year. Start monitoring your A1c. It is very important to track your A1c over the months and years that follow. You need to see what effect your diabetes is having on your health. The reason for tracking your A1c is because doctors are not sure what the best way to measure this is. Since so many people have diabetes, there is no standard method for measuring. In fact, the FDA recently recommended that the current method of calculating A1c will not help to improve the accuracy of results. The best way to use A1c to find out if you need to take any action about your diabetes is to check your A1c at least once a month. If you find that it is higher than normal, start keeping track of it as well as your weight and insulin requirements. If your A1c is still higher than normal, you should discuss it with your doctor. You also need to learn how to reduce your A1c. One way is to include carbohydrates in your diet and cut down on processed foods. These foods add unnecessary sugar to your blood and raise your blood sugar levels. Another great option is to go on a diabetic diet. This involves limiting the amount of dairy and eating lots of fruits and vegetables. It is difficult to achieve a diabetic diet, but it can be done. If you already have diabetes, you may want to speak with your doctor about various tests to see what the best plan of action is. Sometimes blood sugar levels can still be high after you have cut back on carbohydrates and fat. Sometimes it takes a while to get back into balance. Your doctor can order some A1c tests to see if you are still at risk for getting a low blood sugar episode. If you are, then you should eat a low sugar diet to give your body time to adjust. If you do not, you could have a shock, high blood sugar episode and a stroke or heart attack may occur. If you find that your A1c is high, you should consult your doctor. They may need to order another test to see what is causing it. In some cases, low blood sugar episodes can be corrected by changing insulin doses. Your doctor can also take another test to see if you are still getting enough exercise and sleeping enough. You need to stay active if you have diabetes, because it helps your body's circulation. If you have diabetes, you should get at least a 30-minute walk each day. Sometimes even in extreme cases, medications can be needed to correct your A1c. A half hour of vigorous exercise 3 times a week is sufficient. Your doctor may require that you do less or more than this, depending on your medical condition. A1c testing has been known to interfere with work and school. If you feel that you cannot perform without an A1c test, you should get one. If you have diabetes, having an A1c test is a necessary part of living with this disease. To get more information about treating your diabetes, click the link in the description below.